Hello, friends. Hello. It's been a minute. It's been a few minutes. It's been a few weeks, probably even a month, because we have been in our super busy season at the Focus Academy and Brain Blossom, finishing our certification series. Oh gosh, our last certification series for 2022. We have our next certification series that's open now. Actually, we're waitlisted now. So if you want on that waitlist, because we are sold out at this point, like legitimately sold out. We sold out a week after. It's April 20th weekend is the next live portion to finish that certification, and there's the online portion. If you want on that wait list, because we're trying to get a bigger room, and inevitably some people always shift to the next one because of scheduling things. As we have spots open, we'll go to the wait list. So make sure you private message us or message us here and let us know if you want on the wait list. And then that way it's kind of first come, first serve. Anyways, here we are. I'm going to get back into content and support in this group over the whole fall and into next year before that series starts. And I want to start with discussing the brain-based exam and chiropractic, keeping chiropractic at the foundation of this kind of brain-based movement in chiropractic. And this brain-based movement, it's really important to understand that it's not just in chiropractic. When you look at the research that's happening, when you look at the content that's being delivered and created, and the courses and the support and the mentorship and all of this that's happening in education, in psychology, in pediatrics across multiple different modalities and professions, and in chiropractic, it's really heavy on this. We have to look at the state of the child or the individual of any age. And that's what this work is actually not just about pediatrics. We have to look at the state of the nervous system before we have any higher level expectations or therapeutic approaches, or reach any goals, or have an expectation to reach any goals in as far as behavior, learning, socialization, education, all of these things, self-regulation. We have to look at the state of the neurology of the nervous system first, and then we have to look at how it's impacting both the developing brain and the fully developed processing, engaging, functioning brain. And so the beautiful thing about this is when we step back as chiropractors and we understand what chiropractic is all about, what a subluxation does, the impact that a subluxation, whether you're like, hey, I practice more in a musculoskeletal realm and I'm just kind of starting to consider that if there's altered functional movement or altered segments, let's say, in the spine, that actually does impact, mechanoreception, proprioception, and therefore sensory integration. So there is a, let's just say, baseline, even if you're coming from a more musculoskeletal perspective in our profession, when we understand that even range of motion, postural distortion, segmental dysfunction, it does create a cascade of neurological change or altered function, communication. And so that really helps us understand that this thing, subluxation, it's not just a mechanical thing. It certainly impacts the neurology. And so whether you're on the subluxation camp or you've not been currently, I'm wanting you to understand that really subluxation is saying, hey, there is a mechanical or structural component. And of course, if we have that, when we know about just a little bit about the nervous system and the brain, that if there is a mechanical distortion of some sort, then it has to create some sort of neurological component as well. And so that is what we look at when we're looking at the subluxation or the role chiropractic plays on the impact of the state of the nervous system and the brain. Which then we look at other professions and say, like, okay, so if this thing called subluxation, is potentially altering or impacting the state of one's being, neurological being, brain, communication, brain and body, that state, then it's going to have an impact, like all these other professions are saying, on the way that a child moves through development, on the way that a child engages or adult engages, connects, learns in their world. So we can't just look at the end manifested challenges, whether it's a learning challenge, a self-regulation challenge, a behavioral challenge, a mental health challenge. We can't solely look at just that. We have to be able to back it up and look at the whole person. And just like they're looking at in other professions, we need to be able to first look at, well, what's the state of the nervous system? And when we come in, the communication within the nervous system, input, processing, output, and what tools do we need, clinical tools, mentoring tools, educational tools, all of these things, what do we need to use, but have appropriate measurement to know if they are necessary for an individual, so that we can first address that state of the nervous system and then say, and how is it impacting the developmental trajectory or the state of being of this individual. So this is where, we can get into trouble with brain-based practices in our profession and in others. We're saying, hey, we want to look at primitive reflexes, we want to look at eye movements, we want to look at gross motor, fine motor, executive function, and all of those things are super important. And I agree that we should have them in our exam, in our understanding, in our re-exams. But we first, just like all the other professions, we first must look at what is the state of the autonomic nervous system, what are some things I should include in my exam in a chiropractic office, what are some things I should include in my exam to assess that first, and then also assess what's going on this brain-based, we call it our functional brain-based exam, functional brain-based developmental exam, where we include these things like primitive reflexes and eye movements and fine motor, all of these things. So what do we need to include, and how do we make this simple? I'm a big fan of teaching simplicity on the far side of complexity. How do we make this simple and stay in the chiropractic lane, understand our place in this, not try to be other professions, but but understand how these things are put together and how we need to be as chiropractors, as neuro-based chiropractors, should be at the foundation and on the foundational team of working with individuals with behavioral learning, socialization challenges. So the first thing that I want you all to consider in this is, do you have an actual subluxation-based exam, and what is included in that? Do you include that there's a structural mechanical piece that you should be looking for clinical clues for in your exam, a structural mechanical piece to subluxation and a neurological piece? Do you have something in your exam that encompasses both of these? In the Focus Academy and Brain Blossom, and those of you who are certified in this, you know exactly what those pieces are, and you can have really great equipment that you're using in your office with scans and that stuff, and we talk about that, and I think that's great. And if you don't have any of that, you can start with really free, like a pen light, looking at the eyes to start looking at the neurological component. So we have to have a structural and a neurological component to look at the evidence of subluxation being there, impacting the neurology, the input, processing, output. And the second piece of this brain-based chiropractic exam should be looking at that developmental trajectory, not just looking at what individuals, your patients, aren't doing well, but also what tools are they using? What does that tell us about their developmental trajectory or gaps that may be there in their developmental history when we're talking about adults or older kids? So we have to have what I call the two big questions, right? The first question, do we have indicators of input, processing, output, or subluxation, and what do we need to include in that? And the second question is, what tools is this individual using to process their world? What does that tell us about their developmental trajectory, where gaps may be? And that's a really important piece to have in your exam and on your re-exams. We teach you how to include all of this, but I want you to start thinking about this right now. And do you have an organized way, a simple way to answer these questions in your exam process? And if you don't, instead of just going and like adding random things into your exam, reflexes, scans, heart rate variability, eye movements, have an orderly and systematic way to assess the whole picture and know what parts to include in order to have this chiropractic based, brain based assessment so that you can understand what you are seeing, understand how to set appropriate goals, understand how to set care plans from the information you gather on the simple exam, and understand how to do re-exams and use that further to further make recommendations and changes to your care, instead of just kind of randomly picking numbers based on one of those pieces of the exam. We have to know what to include, why to include it, and then how to do that. So we are here to do that. Over the next month or so, I'm going to be diving into this topic a little more and helping you start to know what to include in your exam. Those of you who've taken our certification series, which is a ton of you, and are in Elite Access and Brain Blossom Doctors, you're already including a lot of this in your exams and in your practices by finding the simplicity in it. But some of you, this is new. And so I want to start getting the rationale first and then pulling down. So we do hold apart learning in the Focus Academy. So we're going to start with the big picture and we're going to know why we're including what we're including. And then we're going to build from there. So if you, I want to know, I want to send one of you guys one of my favorite books from Amazon. So if you comment below, we'll put you in a little raffle and we'll send you one of my favorite books. I have lots of favorite books. We'll send you one of them from Amazon. And so we can start this series of learning and get a lot of people engaged and starting to incorporate some of these things that we teach over the next month or two in practice. So I want to hear, what is one thing that you include on your exam, on your subluxation exam, that would either be looking for a structural component of subluxation or a neurological component. So you can just literally tell me anything. It could be posture, it could be, I use HRV, it could be thermography, but one of the components that you use on your exam, and bonus points if you put actually what it's for. So if you say like structural or mechanical, I look at posture, or range of motion, that's looking at the structural mechanical, or looking at the pupils, that's giving me indicators of the neurological component. Just tell us one thing that you do. We'll put you in a raffle. I'll send you one of my favorite books. Super happy to be back with this community. Sorry for the little break. There will be another little break, probably next April, but I'm here to help you guys learn to lead with the brain, to make the case for chiropractic, and there are an abundant amount of people out there that need you to do that right now and are looking for you to do that. If you were in our last certification series, we talked a ton about how the demographic of people that are out there that are looking for your services now are not the same as they always have been, because we have more and more people who have kids and adults who are struggling with behavioral learning, socialization, mental health challenges that were not necessarily in our vitalistic, holistic paradigm. But now they're questioning education, they're questioning the medical system, they're on really long wait lists for traditional therapeutics, and so they're looking for people who can help them. And we need to very intelligently and specifically make the case for what we do and how we can help, and not in some big philosophical way for them, not in a dogmatic way, not in an angry way, but in a way that helps them understand what we do. And the first thing we have to do is understand it ourselves and put these practices in place. So here for you. Glad you're here for this. We have a great community here. Talk to you all soon. Put it below and you'll get in for one of my favorite books. Hello, Scotty. Hello, Jill.